Ladies and gentlemen, the next president of the Massachusetts Medical Society, Dr. James Gessner.
Thank you, Dennis. It has been a true privilege to serve with you over the past year. You have been the immediate release and the extended action to deliver our society's approach to the opioid crisis in Massachusetts, be it with the news media, with the legislature, or with our membership. Scarcely a week goes by without a call to comment for the record. And then there are the AMA task forces, legislative committee appearances, and work with our own MMS committees. You have shared your experiences and your wisdom with your fellow officers and staff. Our approaches to those issues have benefited from your leadership. In truth, no issues belong to a single presidential year anymore. Issues rise to the forefront, recede from the headlines, only to resurface later. Continuity is important, and I intend to follow your example. Thank you again for your wisdom and your engagement. Now I would like to introduce my family and our guests. My wife, Ann, is joined by our daughters, Sarah and Abigail, and by Abby's husband, Bob Shafrar. They're joined by John Boyd and Eileen Boudry. John is a neurologist. We were medical school classmates and interns in pediatrics at Duke. John is the godfather to Sarah and Abby. Barbara and Francis Rocket are here, longtime Norfolk District colleagues, past presidents of the society, and great friends. Jim English and his wife Sally join us. Jim is the president of my group, Anesthesia Associates of Massachusetts, and a colleague and friend for nearly 30 years. Two friends and colleagues from the Lemuel Shattuck Hospital are here. Jim Petros, chief of surgery with his wife Suzanne, and Ken Friedman, chief medical officer with Stephen Weiss. And Alan Harvey, past president of this medical society, is here with his wife, Doris. They're joined by George and Judy Petit. Like the Rockets, the Petits need no further introduction. George and I have served with several professional groups together for many years, and he and Judy are great friends. Thank you all for being here tonight. Your presence is both gratifying and humbling. I've been asked how I became interested in the Massachusetts Medical Society. Let me tell you a short story. I'd been quite active in the Massachusetts Society of Anesthesiologists and had come to a couple of Norfolk District meetings and society annual meetings. Following an annual meeting at a neighborhood block party, I was corralled by two people known to many of us, Doctors George Smithy and William Wheeler. Their message was simple but important. Keep showing up to the Norfolk District meetings. Now, you might be able to say to Dr. Wheeler, I'll think about it. But Dr. Smithy was a different story. He demanded answers, and he got them. In truth, I was intrigued by the Society's advocacy for physicians, its interest in patient care and patient safety, and its stewardship in public health. This was an invitation, or perhaps a command, and I accepted. And then during his presidential year, Alan Harvey asked me to join the Committee on Finance. I became chair, and a year later, Dr. George Garib and I were interviewing John Burns, who became our vice president of finance. During my years as chair, I had an engaging appreciation of this society. What about the coming year? Clearly, we'll continue to do our part caring for patients with substance use disorders. The new prescription monitoring program will assist in managing this aspect of patient care. Our well-received educational programs will be updated and expanded as needed and will remain free of charge for all. We'll continue to advocate for meaningful increases in resources for patients with substance use disorders, and we'll also press for the mandatory insurance coverage for these services. Transparency in pharmaceutical pricing is receiving much needed attention at our AMA and in the national media. These costs, together with high out-of-pocket costs, are a major barrier to affordable health care. New models in Medicare and Mass Health require detailed analysis. And let's not forget the ballot initiatives this fall about marijuana and healthcare costs. Within the society, we should examine our governance structure to be sure that we have an approach that encourages participation by our younger members. Already, 60% of our members are employed in group practices. Younger physicians receive their education in college and onward in project-oriented team environments, often with remote participation. Their interest in organized medicine may favor frequent but episodic participation and from a distance. Is our centuries-old geographic-based governance structure entirely appropriate for tomorrow's employment models and expectations? We need to talk about it. This society has many interests, a terrific membership, all volunteers, and a world-class staff. With that combination, anything is possible. I would like to thank the members of the society for their trust in me. Serving as your president for the next year is the highest honor and privilege. To Corrine, thank you for your friendship, your guidance, and your leadership of our wonderful staff and the society. To Anne, the girls, and I, thank you for your love, support, encouragement, and your unique ability to see through the fog to what really matters. It's been the best 44 years I could ever imagine, and I'm looking forward to sharing many more. Thank you for everything. And to all of you, thank you. I look forward to a great year and have a wonderful evening.